hard to ignore, isn't it? Healthcare in the U.S., it feels like it's always shifting under our feet.
Absolutely. How we see a doctor who's making the big calls, where the money actually goes, it's constantly evolving.
And that's exactly what we're diving into today. We've got three really significant things happening right now. And when you put them together, they paint a pretty revealing picture.
Yeah, three crucial pieces. First, we're going to look at Amwell, the telehealth company, some interesting financial news there, especially linked to a big military contract.
Okay.
Then we'll shift gears to a resolution from Democrats in Congress. It's raising some, well, serious questions about transparency over at HHS, the Department of Health and Human Services.
Transparency, right. Always important.
And finally, we'll unpack the sort of ongoing healthcare policy overhaul that's happening under the Trump administration. Our goal really is just to cut through the noise and figure out what these developments actually mean for you.
Okay, let's start with Amwell then. Telehealth company, most people have probably heard the name. They've had some financial struggles apparently, but things might be changing.
Well, that's the interesting part. It looks like a bit of a turnaround might be happening. Their first quarter results, they showed a much smaller net loss than last year.
Oh, really? How much smaller?
Down to about $18.4 million. Compare that to $73.4 million this time last year. And their revenue was up too, around $66.8 million.
Wow, okay. That's quite a difference. What's driving that?
It really seems to be pinned on this major contract they landed with the Department of Defense. They're rolling out their telehealth platform for scheduled virtual visits across the entire military health system.
The entire system?
Yeah, think about the scale of that. We're talking potentially 9.6 million users.
9.6 million. That includes active military families.
Exactly, personnel and their families. So, the takeaway here could be about these big government contracts, massive growth potential, obviously, but also maybe a lot of reliance on one big client.
Right, so potentially millions using Amwell for virtual appointments now.
That's the idea. And you can already see the impact financially. Amwell said their software revenue, it jumped over 30% compared to last year.
30%.
Yeah, and they specifically pointed to these military deployments. They called it their most significant growth initiative ever.
That's a big statement. Sounds like this military deal could be a real game changer for them, especially given, like you said, they had those financial issues before.
They did. They actually got a warning from the New York Stock Exchange last year. Potential delisting because their stock price fell too low.
Ah, okay.
So they did what's called a reverse stock split. It's basically a way to bundle shares together to push the price back up and meet the exchange rules. So yeah, this military contract seems pretty critical for them stabilizing things.
And are they feeling optimistic about it? I saw something about aiming for positive cash flow.
That's the goal, yeah. Positive cash flow by 2026. The CEO said they made significant progress on that in Q1. But, there's always a catch. Well, the initial defense contract only runs through July, so naturally people are asking if it'll get extended.
Right, you wouldn't want a contract that big to just disappear.
Exactly.
Right.
But Amwell's leadership, they sounded pretty confident. They said the initial feedback's been positive. Service members are already using the platform. They seem to think the government and their partner on the contract are happy.
Okay, well, that's good news for them. It really does show how these big government partnerships can be, well, almost make or break for these health tech companies.
It definitely highlights that link, yeah. Private sector, public systems.
Yeah.
Oh, and one other interesting point from Amwell.
Yeah.
Their CEO suggested that all this economic uncertainty we're seeing, it might actually help them.
How so?
The thinking is, as businesses look for ways to be more efficient, maybe cut costs, but also boost revenue, telehealth solutions like theirs could look pretty attractive.
Huh. So a bit of silver lining for them in economic worries. Okay, that makes sense. Let's pivot then. This resolution from the Democrats about transparency at HHS sounds like some serious concerns are being voiced.
Yeah, this one really gets to the heart of how healthcare policy is actually made, and importantly, whether the public gets a real say.
Okay.
So this Democratic resolution, it's a direct response to a new policy that HHS put in place under Secretary Robert F. Kennedy Jr. And it basically breaks with what's described as, a long-standing practice.
So we just talked about government action impacting a company like Amwell. Now we're looking at the government's own processes.
Exactly. How transparent are those processes? That's the question.
And what was the old practice? the one they're changing?
Well, for years, HHS usually gave public notice and then accepted public comments when they were thinking about making significant policy changes.
Right, so people could weigh in. Doctors, patient groups, anyone interested.
Precisely. It allowed all those stakeholders to give their input before things were finalized.
So the new policy gets rid of that. No more required notice or comment, period.
That's the crux of it. Secretary Kennedy announced earlier this year they'd skip those public comment periods sometimes. Senator Ron Wyden, he was pretty blunt about it. He accused Kennedy of delivering radical secrecy instead of radical transparency, which was promised.
Radical secrecy. Strong words.
It highlights that tension, doesn't it? Efficiency versus public input. HHS might be able to make changes faster this way, but, they risk pushback or maybe missing important viewpoints.
What's the official reason from HHS for making this change?
Well, the policy statement from March said they'd forego public comment when it's deemed impractical or contrary to the public interest.
That sounds kind of broad.
That's the worry critics have, that this exception could be used pretty widely to make big changes without much or any public discussion first.
And this isn't happening in a vacuum, right? There have been other big changes at HHS recently. SPAB cuts.
That's a really important backdrop. Since Secretary Kennedy took over, there have been what people are calling sweeping changes. Mass layoffs, program cuts. The concern is that if you stop the public notices, maybe even more changes could happen quietly.
So the Democrats in Congress are trying to push back with this resolution. What does it actually ask for?
Essentially, the resolution, there's one in the Senate led by Wyden, and a similar one in the House. It demands that HHS reverse this policy. Go back to giving notice and taking comments.
Okay.
Representative Gabe Imah put it very directly. He asked something like, President Trump and Secretary Kennedy's push to rescind basic transparency begs the question, what are they trying to hide?
It certainly made me wonder, but what are the chances this resolution actually passes, realistically?
Probably pretty slim. The Senate one has to get through the Finance Committee, which is Republican-controlled. That's a big hurdle. Even if it got to the Senate floor, getting enough Republican votes seems unlikely.
So maybe it's more about raising awareness, putting HHS on notice.
That seems likely, yeah. But what's really striking here is who is supporting this push for transparency. It's not just Democrats.
Oh.
You've got a whole range of major healthcare groups lining up behind it. The Children's Hospital Association, American Academy of Family Physicians, American Academy of Pediatrics, the OBGYNs, the American Cancer Society's advocacy arm.
Wow, that's a broad coalition.
It really is.
Yeah.
When you see groups like that across the spectrum expressing concern, it suggests this isn't just, typical partisan politics. There's a real worry in the healthcare community about this.
Absolutely. That kind of consensus definitely gets your attention. Okay, let's move to our final piece then, the bigger picture. The Trump administration's overall healthcare overhaul. Sounds like this involves some major shifts with potentially huge impacts.
Yeah, this is where we see the potential for really long-term changes across the whole system. Those HHS changes, we talked about the transparency issue, the staff cuts, they seem to be part of a much larger strategy. And it could have, as the sources say, major implications for providers, payers, and health IT firms.
So, connecting back to Amwell and the HHS policy concerns, this is the administration's broader vision for healthcare.
Exactly. It builds on those points. You mentioned the drastic overhauls at HHS. Let's put a number on that.
Okay.
Reports suggest about 1 in 4 HHS employees, 25% have been laid off, taken early retirement, or accepted buyouts since Secretary Kennedy took charge.
1 in 4.
Yeah.
That's massive. What's the rationale given for that level of downsizing?
The administration frames it as streamlining, making government more efficient. And it looks like more might be coming. There was a leaked budget document suggesting they plan to cut overall HHS spending by another third.
Another third?
Yeah.
On top of the staffing cuts?
Yeah.
That would surely ripple through everything.
Without a doubt. And it's not just about size, it's policy direction too. For instance, the new CMS administrator, Dr. Mehmet Oz,
right?
He said he wants to scrutinize Medicare Advantage plans closely. There have been concerns raised about that program in the past.
That's interesting, but isn't there also a proposal that's kind of favorable to Medicare Advantage?
That's the slightly confusing part. Yes, despite saying they'll scrutinize it, the administration has also proposed what's described as a dramatic rate increase for Medicare Advantage plans.
Okay, seems a bit contradictory. What about Medicaid? That's another huge program. Any big changes planned there?
Medicaid's definitely in the mix. There are proposals for major revisions, potentially cutting federal funding, but that's politically tricky.
Why is that?
because Medicaid is actually quite popular, even in red states. Lots of people rely on it, so cutting it deeply could face real political backlash.
Makes sense. It's a vital safety net. Okay, let's talk about the actual budget proposal for 2026. Sounds like it involves some really deep cuts.
Very deep cuts, yeah. Across a lot of healthcare programs, the CDC and the NIH, the National Institutes of Health, seem to be targeted for particularly large reductions. Overall, the proposal cuts HHS discretionary funding by 26%.
26% overall.
Yeah. And the theme seems to be shifting focus. Less money for broad research and public health infrastructure, maybe more towards fiscal conservatism and specific health promotion ideas. It looks like a pretty fundamental change in approach.
Where are the biggest chunks coming from? You mentioned NIH.
NIH gets hit hardest in this proposal, nearly an $18 billion cut. The budget document calls NIH too large and unfocused, even accuses it of promoting radical gender ideology and wasteful spending. And it's not just cutting money. They propose reorganizing NIH into 5 specific areas and completely eliminating funding for certain centers like those focused on minority health disparities, nursing research, global health, and complementary medicine.
So defunding entire research areas. What about the CDC? They've been front and center recently.
They face a proposed $3.6 billion cut. The budget targets programs labeled duplicative, related to DEI initiatives, diversity, equity, inclusion, or just called unnecessary.
Which programs specifically?
Things like the National Center for Chronic Diseases Prevention and Health Promotion, the Environmental Health Center, the Injury Prevention Center, and maybe most notably, the public health preparedness programs would be shut down entirely.
Shut down. What's the reasoning for that?
The justification given is that states can handle preparedness more effectively.
That seems questionable, thinking about national coordination for emergencies. Are other HHS agencies also facing cuts?
Oh, yes. HRSA, that's Health Resources and Services Administration, they work with underserved communities, big cuts there. SAM HSA for substance abuse and mental health also cut. Even CMS, overseeing Medicare Medicaid, faces cuts to things like health equity work and beneficiary outreach.
So making it harder to reach people and ensure fair access, potentially.
Well, the budget says benefits won't be impacted, but cutting outreach and equity focus could certainly have an effect. Oh, and the Low-Income Home Energy Assistance Program, proposed for complete shutdown.
Goodness, it really sounds like cuts across almost everything related to public health and support. Was anything getting more funding?
Just one area, really. A $500 million increase for something called MAA initiatives.
MLE.
Stands for Make America Healthy Again. These are programs focused on nutrition and exercise, apparently a big priority for Secretary Kennedy.
Okay, so a clear shift away from research, preparedness, equity, towards nutrition and exercise promotion.
Yeah.
How are the medical and patient groups reacting to all this?
Not well. The reaction's been strongly negative. Lots of groups calling it an attack against science and research, saying it weakens public health. Anthony Wright from Families USA said it continues an effort to decentralize and weaken the whole health infrastructure.
And I assume Democratic leaders in Congress are also objecting.
For sure. Senator Patty Murray raised concerns about national security, actually, suggesting that if the U.S. cuts research funding so drastically, countries like China could pull ahead scientifically.
That's a serious concern. But presumably, the administration and its supporters see this differently.
Yes, definitely. Republican leaders like House Speaker Mike Johnson are framing it as necessary fiscal responsibility, making sure tax dollars aren't wasted on, quote, bloated bureaucracy or partisan pet projects. So it really boils down to a fundamental disagreement about the government's role and spending priorities in healthcare.
Okay, so wrapping this up, we've looked at Amwell's telehealth expansion via the military, the whole debate around transparency at HHS, and now this massive proposed overhaul of healthcare funding and policy by the Trump administration. It really feels like these aren't separate stories.
Not at all. They're deeply interconnected, like different facets of a much bigger shift. Amwell's story shows telehealth's growing role, maybe spurred by government contracts. The HHS transparency issue questions how policies affecting companies like Amwell and everyone else get made.
Right.
And then the budget and overhaul plans. They could fundamentally change the entire landscape that companies, providers, and patients operate in.
It really forces you to think about the downstream effects. What does this all mean for actually getting care when you need it? for new medical technologies, for the government's basic role in protecting public health.
And that leads to a really important question for you, the listener, to think about. We see this strong push for efficiency, for cutting spending, but at the same time, there are these major concerns about transparency, about huge cuts to research and public health systems. So the question is, what fundamental values are really driving the future of healthcare in the US right now? It's something worth reflecting on because the answer will affect all of us.
Thank you, viewers, for watching. If you found this video helpful, don't forget to hit that like button and share it with your colleagues. And if you haven't already, make sure to subscribe to the channel by clicking that subscribe button below so you never miss out on valuable insights. I'm Brian Edmonds, signing off. See you in the next one.